Assalamualaikum friends, today I will be starting a new chapter and that is antibacterial drugs. In today's lecture we will be discussing the classification of antibacterial drugs. So for that I have written a single sentence, and from that single sentence I am going to show the names of the drugs. The sentence is antibiotic can terminate protein synthesis for microbial cells like germs. Now you guys have to pick the first letter in the sentence. So from A I have the drug name aminoglycosides, from C cephalosporin, from T tetracycline, from P penicillins, from S sulfonamide, from F fluoroquinolones, from M macrolides, from C carbapenims, from L lincosamides, from G glycopeptides. So these all are the antibacterial drugs. Now these antibacterial drugs, they are either bacteriostatic, means they inhibit the growth of bacteria, or they may be bactericidal, means they will completely kill the bacteria. So they are going to have their mechanism by showing their different methods. For example, if I first talk about the sulfonamide, so they either kill or inhibit the growth of bacteria by inhibiting the folate synthesis. The bacteria usually they have an ego, and they say that we will eat by producing our own folate. So the bacteria produce a folate by its own, and they utilize that folate. So what the sulfonamide do? The sulfonamide inhibit that folate synthesis. So if the folate is not synthesized by the bacteria, so it will not be available for the bacteria for its growth. So in this way they inhibit its growth, or they may kill the bacteria and reduce the infection or cure the person from bacterial infection. The second one, and how you are going to remember that sulfonamide are used to inhibit the folate synthesis, for that here you can see FO. So from FO you guys can catch it that it is going to inhibit the folate synthesis, FO here and FO. Now fluoroquinolones, from here quinolones, you just guys consider it quintuplet. Quintuplets are means when they're when a single during a single pregnancy birth is given to 5 children, so we call that a quintuplet. Each one of them is the quintuplet. So from quintuplet you guys can remember it that the fluoroquinolones inhibit the DNA replication. So just we finished the sulfonamide and fluoroquinolones, that the sulfonamide inhibit folate synthesis while the fluoroquinolones inhibit the DNA replication, and by inhibiting DNA replication they guys either kill or either stop or inhibit the growth of bacteria. Now coming onwards towards the protein synthesis inhibitor, means the protein that are synthesized by the bacteria. These antibacterial drugs, they inhibit that protein synthesis and thus cure the person from bacterial infection. So for that you guys remember trick and or word that is almost, or you can change it to almost, say, right? Okay. So from A I took aminoglycoside, from L lincosamide, from M macrolides, from O oxazolidinones, and from as we just change it to other O, so oxalidinones, and the other O others drugs are the chloramphenicol, quinopristine and dalfopristine. Now how you're going to remember these drugs names? So the aminoglycoside, lincosamide, macrolides, oxazolidinones, and others, the chloramphenicol and quinopristine, or you may say dalfopristine, these all are the antibacterial drugs, and they inhibit, they are bactericidal or bacteriostatic, and they inhibit the protein synthesis. They inhibit the synthesis of protein, the protein that are being synthesized by the bacteria. They inhibit that synthesis, and thus they cure the bacterial infection. Now for how you're going to remember the macrolides drugs, so for that you just remember a name, or you say throw the mice, right? Mice, chuha. So throw the mice. So from thromycin, so in macrolides each of the drug ends with the word thromycin. So azithromycin, clarithromycin, erythromycin, telithromycin, these all are the macrolides, and they all work by inhibiting the protein synthesis, or you may say they are the protein synthesis inhibitors. Okay, so just here if we look at the classification, so aminoglycoside, these are the protein synthesis inhibitor, and okay, the last one T is for tetracycline that today we will be discussing. So aminoglycoside, it is the protein synthesis inhibitor, tetracycline protein synthesis inhibitor, macrolides protein synthesis inhibitor, lincosamide protein synthesis inhibitor. What remains? The remaining drugs are the cephalosporin. So the cephalosporin C, they inhibit the or they inhibit the growth of bacteria by inhibiting by altering the cell wall synthesis, or you may say they are the cell wall inhibitor, right? Cell wall synthesis inhibitor. So cephalosporin inhibit the cell wall synthesis, penicillin inhibit the cell wall synthesis, carbapenem cell wall synthesis inhibitor, and glycopeptide cell wall synthesis inhibitor. The CC, the first C, you can just directly, cephalosporin and carbapenems, you can just directly get it to the point that they are cell wall inhibitor. The remaining are the penicillins and the glycopeptides. Just remember GP, so they are also the cell wall synthesis inhibitor, right? So they inhibit the bacterial growth, or they kill the bacteria by inhibiting their cell wall synthesis. So now we are going to our next today's the main topic of our discussion was protein synthesis inhibitor. So in protein synthesis inhibitor, I just took the first drug, and that is the tetracycline, right? In almost the last one T, tetracycline. So in this lecture we are going to discuss the therapeutic application of tetracycline and some adverse effect of tetracycline. So for therapeutic application of tetracycline, you just remember the name BBC Marvel. So B for Borrelia burgdorferi, and this is a bacteria causing Lyme disease. C for a chlamydial infection. M for Mycoplasma pneumoniae. E for acne. R for, and this was this came in the last paper, that acne is caused by which of the following drugs? So the answer was tetracycline. So this one is important, acne, right? For acne we give the person tetracycline drugs. Okay. Rocky Mountain spotted fever, rickettsia causes the Rocky Mountain spotted fever. Vibrio cholera causing cholera, it's a bacteria name, gram-negative bacteria. Okay, Lyme disease, it is caused by Borrelia burgdorferi. So for these all diseases or infection, we gave the tetracycline, and for that you just have to remember BBC Marvel, Borrelia burgdorferi, C for chlamydial infection, M for Mycoplasma pneumoniae, F for acne, R for Rocky Mountain spotted fever, or you may say rickettsia causing this disease, and V for Vibrio cholera causing cholera, which is gram-negative bacteria. Vibrio cholera is gram-negative bacteria, and this is the last one here, cholerae. So okay, the last one, L, Lyme disease, Borrelia burgdorferi causing Lyme disease. Okay, now coming onwards towards the adverse effect of tetracycline. So for that, just remember a word, devil's cap. So from dedentation, means this will cause the discoloration and hypoplasia of teeth, and it will also cause some temporary stunting of growth, right? Now E for epigastric pain, nausea, vomiting, diarrhea. You may see that gastrointestinal abnormality or dysfunction is there in the side effect of tetracyclines. Okay, V for vestibular dysfunction, and in that you can say tinnitus or vertigo. Okay, I for insipidus diabetes, or you may say diabetes insipidus, in which there is more urination. The glucose level normally is usually normal. In diabetes mellitus, the glucose level is high, but in insipidus it is normal, but the urination is more. Now it can the side effect, liver damage is also a side effect of tetracycline, super infection, and C cap, as it sound K, so kidney damage. It also causes kidney damage, anti-anabolic effect, and the last one P is for the phototoxicity. So this was all from my side, guys, and this was all about today's lecture. So Allah Hafiz for now.